Glad to hear
Good
you.
evening, everyone. It's so nice to see you. We are so happy to be hosting the NCAPA Town Hall this evening. I'm Alicia DeTroy. I'm a practicing PA and your NCAPA president this year. It is my distinct honor to be moderating the conversation tonight with our legislative colleagues. NCAPA has a great working collaboration with our legislative colleagues every year, but I would say especially this year in the pandemic, we are so grateful for your tireless work, especially on policies that are relevant to PA practice. I want to thank you for your support of several legislative pieces of legislation that are critical to PA practice, but I specifically want to call attention to Senate Bill 704, the COVID-19 Recovery Act. Most notably, this was the piece of legislation that removed quality improvement meetings for PAs from this year until 2021. And really that is critical, allowing us to focus our attention on the bedside care of patients rather than focusing on administrative paperwork. So thank you. That bill also grants providers immunity from civil or criminal liability for acts related to COVID. Before we start our conversation, I do want to take a minute to just say thank you to all of our PAs who are joining us today or participating at a later time. We have over 7,000 PAs practicing medicine in North Carolina, and we have 11 PA programs training the next generation of PAs. As you know, they are diagnosing illness, they are developing and managing treatment plans, they are writing prescriptions, and to many of our patients, PAs are their primary healthcare provider. We are utilizing our thousands of hours of medical training and our generalist training, which is so critical in this pandemic that we can be flexible and serve in any specialty and any setting. So I look forward to tonight's conversation as we talk about ways that we continue to collaborate with our legislative colleagues and make sure that we are providing quality care to patients and improving access to care through PAs. So with that, I'd like to take a few minutes to introduce our legislators. I'll open it up for introductions. And any opening comments. We'll just go alphabetically. So we will start with Dr. Perrin Jones.
Well, Alicia, thank you for allowing me to join you here this evening. For those of you whom I haven't met, my name is Perrin Jones. I'm an anesthesiologist. I practice in Greenville. And again, I appreciate your time here this evening. Thank you.
Great. And next, we will turn it over to Senator Krovic.
Thank you, Alicia. It's great to see everybody. And thank you as well for hosting. We appreciate it. Anxious to hear some of the concerns that the PAs have and to see how we can work together to improve access to healthcare in North Carolina.
Great. Thank you. Senator Perry.
Thank you. I am down in the eastern part of the state in Lenoir and Wayne County. So we're very familiar with rural healthcare down our way. I started my career in the acute care industry, working for a recruitment firm with hospitals and surgical programs, and then spent about 20 years in the dental industry. So I'm just familiar enough with some of the terminology to become very lost. So thanks for having me today.
Well, thank you. We hope to clear up some of those areas tonight. Next, Representative Sasser.
Well, I'd like to thank everybody for allowing me to be in this call tonight. We're really looking forward to it. I'm in the central part of the state, District 67, which is my new district. Will be part of Cabarrus, part of Stanley, and part of Rowan. But what I'm really proud of is, as far as I'm aware, in Albemarle, which is the county seat for Stanley County, we have the newest PA program with Pfeiffer University, which will have their official opening of their beautiful new building Thursday morning at 7:45. So looking forward to being there, and excited about that for Stanley County. And I'm going to be, although I've worked with PAs, being a pharmacist for 45 years and the only pharmacist in the legislature, I'm a little bit like Jim. I can stand some education and look forward to having this conversation.
Thank you, Representative Sasser, and thank you for supporting that new PA program. We are excited as well. I will now turn it over to Representative White.
Thank you, Alicia, for pulling this together, and congratulations on being elected president. I think this group is just a great group for us to be together and be able to share with you all, because as I sat here and looked at each person and listened to what they said, each person that is on the panel tonight has been very, very valuable during this last 4 years that I've been there, and 2 years for Representative Sasser and Representative Jones and Representative Perry. I forgot. We've got some newbies. Joyce, I guess you're and I are the only ones that's been there for 4 years. But it has been, they're a great group to work with, and they each bring a special talent to the table. So I'm very pleased to be as one of the panelists. I'm one of the 3 nurses in the House. And obviously the quality insurance improvement plan that you referenced, that we were able to adjust during the COVID-19, the initial bill that we put out, 2020-4, I think it was. So we, that was a tough one to get through, but we did that in the health working group, and I'm just going to pat myself on the back. I was cheering a while ago, if y'all were noticing, because that is one that I had worked really, really hard on, and we're really glad that we were able to get that in, because it certainly helped nurse physician's assistants and also helped nurse practitioners. So that was, we were focusing on both of those entities, and appreciate that, and appreciate the Medical Society. We worked with them, and they were glad that we were able to do that, and they did not resist, resist that. So that was a really big plus. And I don't know who got the dates wrong, but it was supposed to extend to December 31st, and that's what was announced. But when it was announced on the floor, it gave us another whole year. So I just think that's a wonderful opportunity to demonstrate a lot of different things. And you mentioned the civil liabilities, and Representative Perrin was significant in introducing that and helping us push it through the health working group. So, so you got a good team to talk with you tonight. We appreciate what you do every day.
Well, thank you. You highlighted some really great components, and I can say that I bet you all feel like I do. When I signed up for the presidency, I had no idea that we would be serving during a pandemic. So, so thank you to all of you. Our questions tonight were submitted in advance from our members of NCAPA. We will have the chat open, but I'm not sure that we will get to any additional questions. But would like to get started asking a few of you the same question. NCAPA has worked with our physician colleagues at the North Carolina Medical Society on a policy called Optimal Team Practice that better reflects modern PA practice. OTP recognizes that PAs work in teams with all healthcare professionals, and having a specific regulatory tie to one physician may limit the practice of a PA and may contribute to some administrative burdens. What are your thoughts on updating PA practice laws and regulations in North Carolina? And I'll just go through based on those in the view that I see, and I'll start with Representative Jones. Are you here? Oh, Representative Jones, you're muted.
About that. God, you would think after all the Zoom calls, I would be a little bit more proud of that. I appreciate the question. You know, as an anesthesiologist, we work very closely with mid-level providers on a daily basis, whether they're anesthesia assistants or CRNAs. So I'm very familiar with the team-based approach to care. That is certainly the model that most anesthesia practices utilize around the state. And I think that it's important that we are able to, try to replicate that same team basis of care in, non-OR settings. So I would need to review the particulars of the current regulations before I could make any kind of comment about how they would best be changed. But just as a general statement, I'm very comfortable with and supportive of the idea of team-based care.
Great, thank you. Senator Perry?
So I probably have a unique perspective about healthcare legislation in General Assembly. I was never really involved in politics until about a decade ago when some legislation was introduced that would have put my company out of business overnight. So I'm pretty sensitive to things of that nature when they occur. I do know about the ongoing conversations, and I applaud them. I'm sure that they feel like they crawl at times because I went through the same type of issue. But in my experience, all things clinical, it's better for the clinicians to work out on the front end and then come to us. Because I think you heard Representative White mention she's nurse number 3. Dr. Jones may be physician number 2. That means out of 170 people, you've got 5 who may have some clinical knowledge. And I promise you, with odds like that, we can mess some things up if you allow us to get knee deep into that. So I think that the fact that the conversations have been ongoing, and what I've heard from the medical society, it's been nothing but praise for PAs. And I think it has a lot to do with the way you're trained, and how you come into that world, and the respect they have for you. So I would anticipate that you guys would be able to bring to us some satisfactory evolutions in that world that we could assist with. But I do think that clinical matters are best decided by clinicians, and not a lot of folks that, I was a business guy. We've got a pharmacist over there. We've got realtors. We've got folks who have been successful in their field, but I can't tell you that we are the perfect ones to make decisions like that. So I think everything should and must evolve. And I was, really happy that the conversations were taking place. I think that's the best route for you guys to bring to us those recommendations that are going to help the profession and help everyone.
Well, thank you for that compliment of both of you of team-based care, and thank you for conversations like tonight so that we can learn more about the PA profession. Representative Sasser.
Thank you, Lisa. I have a long history with PAs. I go back to 1970 when I was in pharmacy school at Chapel Hill and worked over at Duke Hospital as a medication assistant. It was a special program just for pharmacy students. And at that time, kind of what started the PA program, and I don't have the history in front of me to read, but I lived part of it, was all these Vietnam veterans were coming back that were on the front line looking after soldiers with very critical injuries and stuff. And they were doing stuff that only the doctors were doing at Duke Hospital because, it was about saving lives. It wasn't about rank or serial number. So I worked right along with a lot of those, and some of them were nurses at that time, and some of them, just were there to work on the wards to try to get in PA programs. So I guess I said all that to say there's a long history, and there's a lot of real practice that went on to get where we are 50 years later, okay? So it's not like this started yesterday and it's all new and we don't know what we're doing and so on and so forth. So it's a work in process. And as I tell people about the medical practice it's the practice of medicine. You know, we haven't figured everything out yet, and we don't know everything about PAs, and we don't know everything about disease practices, but we will improve this process, and this process is improving. And you PAs have a lot of history to be proud of, because those guys, they plowed the ground for you, and I can't see anything but improvement from in that 50-year process. So, and I look forward to working with the medical profession and the PAs and the nurse practitioners and improving healthcare, especially in rural North Carolina.
Well, thank you, Representative Sasser. I think we'll take one more on this question. So, Representative White.
Thank you. Well, if Vietnam birthed the practitioner program, the need for I birthed the family nurse practitioner program. Let's just say that. I was around when that first program opened up in the midsection of North Carolina, and in the county health department that I was working in. So, but when I think about where we are now with nurse practitioners, with physician's assistants and their need and their value, I think about nursing. When I was a nursing student, when I was a young nurse, I am older than Eve, and so it was a while ago. But nurses did, excuse me, Dr. Jones, but we did respiratory therapy. We started all the IVs. We did, and it was the glass bottle, so it really was a long time ago. But we nurses did we were the nutritionist, we were the pharmacists, we were we did a lot of our scope was really, really broad. And then all of we did the PT. So, and that did not hurt nursing. It made us stronger. Obviously, it overworked us, and we couldn't do as thorough a job as sometimes we needed to do because we were doing too many things. So when other entities and other disciplines started coming on the field, into the field of healthcare, nurses were a little bit, why are they doing that? We've always been able to do that. But once we realized that it allowed us then to do our job and to have a deeper understanding of nursing and a deeper clinical skill scope of nursing, when we were not doing all of the other entities. So I kind of see that as an example of, and I'm probably getting a little bit too, I'm trying not to get too into the medical society's role, but I have spent a lot of time talking to the medical society in the last year about this issue. And I know that they are very pleased with the physician assistants. I know that they are looking at ways to broaden that scope. And I just think that this optimal team practice would be a value. And the reason I was so proud of the QIP is for nurses and physician assistants, for nurse practitioners and physician assistants, is that I think it is going to give us a time of, let's look and see what happens this year and a half. Let's gain from that applied research, I guess. And let's keep an open mind about how we can all work together within our own scope, but being able to be more proficient in our scope. And it will not take away from any of the other disciplines. And I think that's just a fear. And I know I experienced that too as a young nurse, when all of a sudden people were doing things that I had always done, But I think that in talking with the medical society, I think that they are beginning to see that may be something that we can consider. So I think it is very important that we've got it out there. I think this, COVID has brought us lots of horrible things, but it has also brought us an awakening in some areas that maybe we needed to look at and be more acute to. So I think that this could be a win-win for all of us in our own disciplines and our own scope, and a win-win for North Carolina, because as Representative Sasser said, as Senator Perry said, Eastern and Western rural North Carolina has got to have help. And money sometimes won't buy it. It's got to be in people making a commitment to stay there and give their training and give their service back. So So anyway, I think it's a great learning opportunity for us.
Great. Well, all of your comments have very nicely set up our upcoming questions, so thank you very much. I'd like to direct the next question to Senator Kravick and Dr. Jones. As the healthcare industry as a whole has been hit by the pandemic, PAs have lost jobs and have had their hours reduced. What can the General Assembly do to ensure that we have the provider network to meet North Carolina patient needs?
Thank you, Alicia. I'll go first, Dr. Jones, if that's okay.
Yes, ma'am.
We understand the teamwork. I join my colleagues in giving accolades to the PAs and the team that they have, the teamwork that they're providing. And as Senator Perry said, actually, I think I'm the only one on this panel who really doesn't have any healthcare experience other than just chairing the committee. I was not involved in healthcare at all. I was in real estate, as Senator Perry alluded to. So I really am the novice among this panelists because many of you have lots of experience in the field. But I was not aware that the PAs had lost so many hours and had lost jobs until you made me aware of that. I had not heard that before. So we did allocate some CARES Act funding to hospitals and to some practices that should help. Hopefully this is short-lived, but in the beginning, it was to slow the spread, to keep the hospitals from being overwhelmed. And as we know, people didn't seek health care. They put off elective surgeries, and I understand we're still having trouble getting people back to see their physicians. Many of the physicians are telling me that people still aren't coming back. So hopefully that will be short-lived because we definitely need people to get back to their physicians and to get back to get the health care that they need. But hopefully some of the CARES Act funding is going to be making its way to those shortages that the hospitals and the practices have been experiencing. And hopefully it will be very short-lived. I think many of them have already gone back to work, and some of the hours have been restored. The ones that I've spoken with, they are back. The one was furloughed for a couple of weeks. I think one was furloughed for 4 weeks that I've talked with, but I didn't realize it was widespread. So I'm glad you made us aware of that. But hopefully it will be back on track and things will be getting back to normal. And I think they already are starting to see that.
Dr. Jones?
I think his feed may be frozen there.
Frozen, yes. So we'll come back to Dr. Jones in a few minutes. The next question I'd like to ask is to...
Hey, Alicia, connection.
Oh, you made it. Great. Thank you, Dr. Jones. Go ahead.
Alicia, can y'all hear me? I had a little bit of a fade out there for a second.
Little problem with connection, but you're fine now. Go ahead.
Well, I appreciate the question. It was an interesting paradox that healthcare faced, especially the delivery system in particular, faced during the initial stages of the COVID pandemic, in that while there was perceived to be an overwhelming need for healthcare to be delivered, there at the same time was like a dearth of people coming into care settings, cut back, and people being furloughed and everything in other industries. I do think that the CARES Act funding that we were able to allocate to hospitals and to individuals. Yeah, I will.
All right, we're getting a little connectivity issues with Dr. Jones, so he's going to log off and come back in to join us. We'll go ahead and go to our next question and then come back to Dr. Jones. Next question for Representative Sasser and Representative White. How can PAs ensure the public and the General Assembly better understand the value that PAs bring to the healthcare teams? And we'll start with Representative Sasser.
I'm fine with ladies first, but okay, I'll go first since I was directed to go first. Well, and I'm sure, again, we've got this long 50-year history, so there's probably not any area in North Carolina that people don't have hands-on, first-hand experience with dealing with physician assistants. I know particularly our doctor's office beside our drugstores, all of them, have either physician assistants or nurse practitioners or both in them. And the majority of the patients, if you're lucky enough to be a healthier patient, not age-related, but disease-related, then you don't see the doctor every time. Now, the doctor may be there till 10:30, 11 o'clock, midnight. I know at one of our drugstores, he is going over all the records to make sure, everything, didn't miss anything. But yeah, we've all been exposed to the physician's assistants, and I'll just be honest with you, I don't know of anybody that's not happy with that care. Maybe you PAs get a lot more training in people skills than maybe some of the physicians do, but that's been my experience as a pharmacist in dealing with the PAs. They're more accessible. Maybe they're not as stressed out, whatever. But the personal care with a physician assistant is just excellent. I mean, I don't hear any complaints about the care that comes from PAs. So
Well, thank
my
you.
hat's off to you. You do a great job.
Thank you, Representative Sasser. Representative White?
Well, I'll speak to the public, having an option to know more about what the PAs are doing and their importance. Nursing went through this at one time too. Nurses used to be identified in a hospital because we always wore white. We wore white shoes, white hose, we wore a white cap. And so everybody knew that we were a nurse. And then all of a sudden, somebody had the big idea that nurses should be dressed like slouch potatoes. And and they started wearing all kinds of crazy colors and designs and all that. And so, and we didn't want to, whoever, and I'm not being facetious, I'm just saying that, to have a little bit of humor, but it kind of looked like that to me. And all of a sudden nurses could never have painted nails. We always had to wear our hair up. We had to not wear cologne. There was a real strict structure to how we had to dress and be around patients, because it oftentimes the aroma of a fragrance, would make someone more nauseated. So as long as nurses had that high standard of the way we dressed and the way we kept ourselves groomed, we didn't have a problem with people knowing that we were the nurse and appreciating us for that. When we started looking like, well, at that time it was orderlies and aides and LPNs. And then all of a sudden the dress code became more relaxed. People started wearing long fingernails and, doing all these things that we had never been able to do before. And therefore we all of a sudden started meshing in together, and nobody knew whether you were an aide, a male aide, a female aide, whether you were the nurse, the doctor, whatever, because everybody kind of looked alike. So what nursing did, we decided that we needed to have a big nameplate. And now because of 9/11, everybody has a big nameplate. So you kind of know, so that still took that knowledge, that kind of identification away. So I would just say to the PAs, one of the simplest things you can do so you can be recognized for who you are and what you do is to wear a common uniform that everybody knows is a PA uniform. That, I mean, it sounds simple, but branding yourself is very, very important. And as far as how you can get the legislators to know who you are and understand, visit us. Each one of you has a representative that represents your district where you live. It's easier for those people in my constituents to visit me because I'm right next to Raleigh. But if you live in the far east or west, it's harder. But you can arrange a day to do that and come. And sometimes if you're just in Raleigh shopping, drop in and say hello. And most of I think all the representatives and senators appreciate you doing that. The other thing is that keep us on your mailing list. When you've got information, send us your newsletter from your organization. And I enjoy getting those because I take time to read them, and it helps me to know what's going on in different associations and different organizations. And sometimes it's the beginning of a bill idea, and sometimes at least we know where you are when you come in with a problem. And if you have an ask, don't come to us 24 hours before you want it on the floor, because it's just not going to happen. And it sometimes causes bad blood because we feel bad that we can't do that, but most people don't really understand how long and drawn out that legislative process is. So when you have I see Senator Perry nodding his head. Thank you. When you have an idea and you think it's something you want us to think about, shoot us an email and let us. We all have their nc.gov email. You can send each one of us our first name, a period, our last name, and then ncleg.gov. So just let us know ahead of time that these are some ideas you're having. This is something you would like for us to think about, because that really will help us to get to know you better and know when. And we can start thinking about it ourselves and working with you on making it a good bill if that's what's necessary, or just a policy change or regulatory change. So those are just some of the things. And also, I don't know if you have a lobbyist, but make sure that your lobbyist does not be afraid to come and talk with us. And I do want to just say one thing, that Senator Provitt may not have graduated from nursing school, and she may not be a pharmacist, but let me tell you something, that woman knows her health care. So thank you, Senator Provitt.
Yes, thank you for your leadership with the committee. That's very appreciative.
Alicia, can I add something to that? I know you didn't ask me that question, but I want to encourage your members to come to our healthcare meetings and let us hear from you. If there's anything of concern that you have that might interest us, because as I said, I wasn't in healthcare. Most of us know a little bit about what we did before we got there, but we're asked to deal with hundreds of things that we don't know anything about. And we learn from you. It's how we know what we need to do, because we're listening to the people that are the boots on the ground. So I would encourage your members to take turns, come down to our legislative oversight health committees, to our regular health committees, and just listen and let us hear from you. We have usually invite the public to speak and let us know what your concerns are. So I would definitely encourage you to do that.
Well, absolutely. And we were so sad that our PA Advocacy Day was canceled this year due to COVID, but several of us have participated in the virtual options. So thank you for that invitation. I see that Dr. Jones has joined us again. He was going to talk to us about PAs that have lost jobs and have had their hours reduced. What can the General Assembly do to ensure that we have the provider network to meet North Carolina patient needs?
Well, I apologize for the internet issues. I think my whole system at my house needs to be rebooted or something. It was an interesting paradox during the initial phases of the pandemic, that while we were anticipating this deluge of patients coming in and care that needed to be given, there actually, in a lot of ways, were a real dearth of patients coming into clinical settings. And that certainly did lead to, a cutback in people's hours. Certain people ended up being furloughed. As Senator Krovic said, that, we were able to allocate funding to both hospitals as well as to individual practices. And so I hope that money will be able to kind of filter its way out to individual PAs and other providers that have been impacted. I know with my own practice, we were able to get funding through the PPP program, and we, used that funding as well as kind of banking hours. We kept all of our AAs and CRNAs on the job throughout, even though we didn't have them necessarily come into the hospital, but we kept them employed. We kept them fully paid. We did ask them to furlough or to bank their hours so that we could kind of recall some of those hours and not have to pay overtime when they came back into work. And that was very effective, as we were able to keep roughly 280 people around the state on the job throughout the pandemic. So I'm hopeful that the truncated time course that people were not coming in to receive elective care, combined with those other programs, have at least been able to do something to be able to get some relief to people. And then hopefully the normal cycle of patients coming in and receiving care will be able to take over from that point forward. If that has not been enough, then that's something we certainly need to look at, because one thing we don't want to do is lose providers to other states, because it would be very difficult to be able to recreate the provider network that we have. And in many ways, I think we probably need to be looking to expand that network in certain rural parts of the state and other parts of the state that are underserved.
Great. Well, thank you so much. The next question we're going to direct to Senator Perry, and actually, Dr. Jones, another question to you. As a PA, I see patients struggling with health insurance coverage. What are some potential solutions you see from the General Assembly's perspective? And we'll start with Senator Perry.
So I think you saw some of the legislation introduced in this past biennium, and some of it was pushed by Senator Krovic and others at the request of the average working people in the communities and different associations, and that was association health plans. And I think allowing them to be competitive where they purchase insurance and what type of rates that they could offer, that's very valuable. If you think about the biggest changes we've seen over the last decade or so as health insurance costs have risen, the difference in cost, whether we like it or not, is mandates. And whenever we mandate something take place, there is a cost with it. Everyone dreams that insurance companies will just decrease their profit or they'll soak up the cost. That's not the way it works. So when you have mandates and the state requires, even more so than the ACA required when commonly known as Obamacare came out, and the mandates that were on those plans and the different levels of plans that we talk about, mandates are expensive. And Senator Krovic has led the charge on trying to be open to talk to every group who comes in and talks about their needs and what has caused them specific pain, because like every great idea on the front end, they're never perfect. There are unintended consequences. And that when we passed association health plans with bipartisan support, I think it was a great step forward. And unfortunately, it's been enjoined by a federal judge, and it is not in place yet. But I hope that we continue to see legislation of that sort that allows for more to meet more individualized needs and doesn't ignore the laws of supply and demand. So I think we've seen that and different approaches. We also had a direct primary care bill this year that, again, Senator Krovic, she's always on the front edge of the good ones, because as Representative White mentioned, she spends hours meeting with people. They talked about having folks come in and talk to them if they have faults or ideas or concerns. This is a part-time job on paper only, and there's many hours that they have spent in the past, being there longer than the rest of us, just talking to constituents and different interest groups. So I look forward to continuing to cultivate those relationships and seeing more really common sense solutions that could be helpful, whether you're in a big town or a small town. And I tend to worry more about those small towns, but those would all be fantastic things for us.
Thank you, Senator Perry. Other thoughts, Representative Jones?
Well, I know one of the kind of the hot button discussion items around increased access, not necessarily increased care itself, but increased access to care, has to do with Medicaid expansion. And I think at some point we're probably going to need to have a full discussion of Medicaid expansion. I think unfortunately there's some people that have tried to minimize the complexity of doing that to a slogan that would essentially fit on the bumper sticker of a car. And I can assure you that looking at that issue, if we were going to move forward with it, is much, much more complicated than something that can be answered in a simple soundbite or a slogan. As an example, our current system has evolved to the point where it is that basically where there is a cost shift from private pay to cover chronic underpayments from both Medicare and Medicaid. If we were to expand Medicaid, you could potentially have a diminution of people that are on private payrolls, and that could actually end up undermining the system as a whole or destabilizing the system over the long term. Other concerns I have with that involve undermining the delivery of care for the most vulnerable people in our society, the people for whom that system was initially created, if we were to expand and then run into an economic contraction such as we saw in 2008, as well as here recently with COVID. So one thing that I would like to see is actually a move to more value basis in healthcare. I think that through driving efficiencies in our care delivery system, whether they're at the primary care level with accountable care organizations, which I'm very familiar with, or with people in hospital settings, especially if they're going to go in and have some type of procedure, driving efficiencies through the perioperative surgical home, which is another care model that I'm very familiar with. I think if we could drive efficiencies in the system, then we could probably end up increasing access to care without necessarily having the check have to cut, or having the state have to cut another check for it.
Well, great. Well, your response sets us up for our next question just perfectly. This is going to be to Senator Kravick and Representative Sasser. What solutions would you propose to increase access to care, and how do we create new options for affordable health care? And we'll start with Senator Kravick.
Thank you. Well, some of the things we've already talked about. One of the association health plan that Senator Perry alluded to, that was going to reduce premiums by as much as 30% for a lot of small businesses, so that they could pool their resources together and buy a large group plan, and it was going to reduce costs substantially. And hopefully we'll be able to get that done. But those kinds of things, we need to continue to be creative. We also had a bill this year that relieved direct primary care physicians, clarified that that was not considered insurance. That's another great way to reduce costs by encouraging people to join those direct primary care physician plans. We have to continue to look for every way. And Representative Jones, Dr. Jones, said it beautifully. The cost shifting doesn't reduce the cost. It just shifts it to somebody else. We've got to find a way to just be better to reduce the cost. We all know we've tried every way we know to keep people from using the emergency room for their primary care. And yet a lot of folks continue to do that, particularly within the Medicaid system. I think the transition that we've finally gotten done, and that's one of the things I'm very proud of, is that we were finally able to get the Medicaid transformation, at least have a date that it's going to start. It's way behind schedule, and I was very disappointed that we didn't get to start it last year, but I think we're going to see some cost savings there. I think we're going to be able to see a lot of benefits to better access to care for a lot of patients. So I'm looking forward to seeing how that's going to play out. But we need to continue to be creative. But we've done a lot of things that are helping, and we just have to continue to look for other ways to do that, and other avenues that will reduce the cost so that it makes it more accessible for everybody.
Great. Thank you for that response. Representative Sasser?
Thank you, ma'am. Everybody has an opinion, okay, about how we're going to fix health care. There's a large group of people in the legislature thinks we need to throw a few more $1 billion against the wall and see how it bounces off. No other states have taken that approach, have been happy with that approach. So my opinion, and all it is an opinion, I do have a vote, but it's just one vote out of 170. But in our process to try to fix Medicaid is where we probably need to start. And my big question is the people that came up setting up Medicaid that decided to set it up on your income level and not your disease case erred, okay? There's people that go to work every day, work 1, 2, or 3 jobs that cannot afford health care today. And they have disease processes that need medical care. Now, there's a large number of people on Medicaid that were born with great genes. No matter what they do, if they smoke, drink, never sleep, whatever, they're going to be healthy. Why do those people have Medicaid? It's a waste of resources. And then we put all this weight on the system to take care of these people that don't have insurance because it's too expensive and they have diabetes and heart problems and asthma and everything that makes us all vulnerable for when something like COVID comes along. So, maybe managed health care for Medicaid's going to help us, but we got bigger gorillas in the room and bigger fish to fry, I'm afraid, because basically all managed health care does, they have 2 options to make their profit. They can either deny services or not pay the people providing the services as much money as they were being paid before. So personally, I don't like either one of those options, but it is a process, and we're talking about the process, and all I've given you is an opinion.
Thank you so much, Representative Sasser. We are wrapping up with our final question of the night, and then we'll have some closing remarks. This question goes to Senator Perry and Representative White. One of the key barriers to the PA workforce pipeline is access to high-quality clinical rotations. Several states have enacted tax incentives for medical providers who precept additional students in the form of tax credits to promote more clinical placements. Should North Carolina consider something like this? And I will turn it over to Senator Perry.
I think everything is worth considering, and we pay for medical education one way or another. There's always a cost involved. When we start talking about tax credits and things of that nature, there is a process to go through to find out what the fiscal impact would be to try to get a fiscal note on something like that. I'll tell you from a timing standpoint, there probably hasn't been a worse time to think about a tax credit when we face a $4.2 billion revenue shortfall already. But just from an idea of having incentives aligned, I think it makes sense to explore, as with some other avenues of different compensation. If incentives aren't there, if incentives don't change, we'll probably keep getting the same thing we're getting today. So I certainly appreciate the structure. But the pragmatist, and I'm not a clinician. I'm a numbers guy, and I do think about the shortfalls that we face. So just from a realistic standpoint, the last time we had a recession and faced a budget shortfall anywhere near this magnitude, it took a decade for the per capita income levels to recover. So we probably are going to be facing an uphill slog, even with we're in great shape with having a rainy day fund of about $1.1 billion and unreserved cash on the balance sheet. but make no mistake, we'll still feel pain in the economy. So I think the general concept is right, though.
Great, thank you. Representative White?
I agree with Senator Perry. I think that, we are a legislature that is known for doing tax incentives for business. And we have done that several times in the 3.5 years that I've been a representative. Again, timing is the issue right now. But I think that because of the known shortfall, and we don't know how big it will get. And again, like Senator Perry said, we have some reserve accounts, but we've had to dip into those already. So I don't, asking for tax incentives and extra money right now is probably not the best timing. But again, that does not mean that we can't begin having that discussion. And I say that because when you say quality clinical rotations, are you saying that physicians, assistants, students do not feel like that some of the places that they go to are providing quality help? And I'm not necessarily asking you to answer. It could be a rhetorical question, but I just need to understand that. So at some point, if you could text me and let me know, are they saying that some of the places that they go to get their clinical rotations are not quality places? Or is it just not the type of quality place that they want to go to? So I do need to understand that. And also, I would like to know, it was my understanding based on some years ago, and it may be changed now, but and I did call to get that information, but I wasn't able to get it before we went on the air. So I do want to understand exactly what the preceptors, I don't know if you call them preceptors or if you just call it the clinical placement, but does the person who is overseeing the clinical rotation, are they reimbursed for that? And so this tax incentive would be an additional thing, or are they not getting reimbursed? And so the tax incentive would give them a reason to want to tutor, mentor, precept a PA. So I would need to know those. Those are some questions that I would need to know before I could think about moving forward with a request for a tax incentive when the timing was right.
Well, it sounds like we have some homework to do, and we will get back with those answers. I do think it's important for all of you to hear. We have high quality clinical rotation sites. The problem is that we have 11, almost 12 PA programs in the state, so there's just not enough.
Okay.
So we just need to incentivize additional sites. So great question. Thank you so much for that wonderful insight on all of those questions. I do want to give an opportunity for some closing remarks, and we would like to hear your most rewarding incident in the serving in the General Assembly in your closing remarks. I am going to go back to Senator Perry first, as he has a time commitment and needs to jump off after his remarks. But thank you, Senator Perry. We'll go to you.
Thank you for that. Being so new, I was appointed like Dr. Jones, so I wasn't there the full 2 years. I have a short runway to have any real accomplishments. But for me, I was able to help a constituent with a very real world issue and change a state law related to a tuition penalty, that if you went over X amount of hours, you had to pay a 50% penalty in tuition, and we were able to repeal that. So being a short timer there and not really knowing, finding the bathroom was a great accomplishment up there for me. It's that building is very confusing, but so much to learn in such a short amount of time. I was proud to be able to do that, because that was helping people with a real world issue. We read about so many contentious things every day that do not reflect what we do day in and day out, and the good relationships that we generally have up there. And, most things are not contentious. So that felt good to be able to do that and actually get something across the finish line as a freshman that, we pay our dues as freshmen, and we endure a bit of hazing also. So that was a nice thing to be able to do for someone.
Well, thank you so much, Senator Perry, for joining us tonight. Thank you for your service, and we hope that you have a wonderful evening. I will now turn it over to Representative Sasser. What has been your proudest moment in the General Assembly?
Again, thank you for the invitation, Lisa. I think all of us are basically going to say the same thing at the end of the day, and we have good days and bad days just like everybody else does. And some days you say, why did I do this? And then the next day, some constituent will send you some nice note, thank you for helping me get my insurance straightened out, or thank you for helping me, get my unemployment check, or just things, or I just, and on tight road, and everybody's got a tight road. It's not on the way to anywhere, but I just got a bridge repaired on tight road. That means people can actually get to their house now. Just those little things like that makes it all worthwhile. And I've had my struggles, as Jim was saying, with I had a big PBM bill that we worked so hard on, and as one of the lobbyists told me, we got it to the 98-yard line, but we couldn't push it in. So we'll go back next year and we'll work on that again. So I'm going to close by just saying to all your PAs, and I know I own drugstores for over 30 years, so I know what working 60 hours a week is, and, not having time off and all that stuff. But let me encourage you to be politically active. Now, so come in our offices, call us, text us. If you don't look after your profession, then you deserve what you get. And that's not being a bad person. It's just telling you the real truth. So be active, be connected with your legislators. And I promise you, everybody on this panel, you will be more than welcome in our office anytime. And we appreciate what you do. And again, thank you very much.
Thank you so much, Representative Sasser. Senator Kravick.
Thank you, Alicia. Thank you for hosting. I would say there's several things I'm very proud of. I'm very honored to serve the folks in my district and in North Carolina. One thing I'm most proud of is I was able to pass a bill, actually my first session there, which provided insurance for children with autism, which we had been working on there for about 10 years and just couldn't get it over the finish line. So I was very happy when that finally happened. It was able to meet the needs for a lot of families who have children with autism. And then the Medicaid transformation, as I mentioned before, that was a huge lift. And we were worked on it a long time, and it's still taking a long time, but very proud of it. And the Association Health Plan bill, that's probably one that I think will have the biggest impact on providing more access to health insurance for more people than anything we could possibly do in North Carolina, if we can get that one over the finish line and done. And we appreciate all that. Your Representative Sasser said it very well. You're a great team. I don't think anybody has ever been to a doctor, had an affiliation with a doctor or a hospital that they didn't establish a relationship with a PA. So we appreciate all that you do, the service to our citizens all across this state. We know how valuable you are. And Representative Sasser is exactly right. Let us hear from you. We don't know what your concerns are if you don't tell us. So we're always anxious to hear what we can do to improve your profession. So we appreciate the opportunity to talk to all of you. So thank you.
Thank you so much. Representative White.
I am a constituent server. That's just what I do. I was on the school board for 12 years before coming to the House, and that's the kind of legislature legislator that I am, and all of us are different kinds of legislators, and there are different things that we all have to do to stay in the position. But some people just like to write those bills, and some people like to lobby the bills. But I'm just a constituent server, and that's what I get the most enjoyment out of. So March, April, May, June, and half of July, I was literally, and this is the God's truth, I was spending 22 hours a day, because I was getting 600 to 900 emails a day from constituents. I was getting, being on Zoom calls, usually 6 to 9 hours a day. And I'm saying this for all of us, and I was getting 200 texts and 50 phone calls every day. And most of it was about unemployment, which I've learned a lot about unemployment that I knew nothing about before. But the other things were, because of being a health chair, a lot of that was coming from, EMS, EOC, the hospitals. I was literally loading trucks up to take supplies out of the schools and the CNA classes and take them over to the hospitals because they had no PPE. So working through the COVID initiative, obviously has impacted all of us. And I'm sorry that we had to go through it. I'm sorry their states had to go through it. But being the public health professional in the house, and that's been what most of my career was done, public health, and home care. It was just an honor to be there and to have that service kind of mentality already, and just get out there and put the boots on and the gloves on and do the work. So that was very important. I guess the most single bill that I got past my freshman year was a newborn enzyme testing, so that 3 additional enzyme tests could be done, so that children would not have to suffer from debilitating illnesses if they were not diagnosed within the first few months of birth. Unfortunately, and this is an example of how hard you work, you get both houses and you get the to vote on it, you get the governor to sign it, and then it sits over in a department where it's still sitting and has not moved at all. So that's, there's some discouragement even with the blessings. But anyway, just to be a part of this team, I look forward to going to the office. When we go to the office, I look forward to not always being up to, 22 hours a day, but at least I knew that I was helping, and that's just who I am. I guess that's just the nurse in me. So it's been an honor to serve in that capacity. And thank you so much for what you all do every day. And I know that each person on the call, and I know all of the physician assistants, put that same level of commitment. So thank you for what you do.
It certainly reminds me of putting the patient in the center of the team, putting the constituents first. So thank you for your service. Representative Jones?
Well, thank you again for your time here this evening, and I appreciate the service that the PAs provide to patients across North Carolina. Y'all do a tremendous job and are obviously an integral part of the healthcare team. That's kind of the question you ask is a very difficult question to answer. I mean, quite frankly, I consider myself to be sort of fly below the radar kind of person. So to be asked to serve in the General Assembly, obviously you're now flying on the radar screen as opposed to below it. And also to be part of a profession, being an anesthesiologist, I think generally speaking, we're kind of fly below the radar kind of people in general. And then for the pandemic to come along and be a part of a specialty that's kind of at the forefront of dealing with it, that was sort of another, putting yourself on the radar as opposed to flying underneath it. I like to think that through our work with the healthcare COVID work groups and with the other work groups, we were able to do some pretty positive things for the people of North Carolina. I certainly like to think that we were able to at least give the state the framework necessary to be successful with regards to our response to COVID. But in terms of one thing, I think that very early on in my time, I got a call from a lady whose son was incarcerated and he was assaulted while he was incarcerated and had been sent to the hospital and then was sent ultimately to a tertiary care center that was some distance from where they live. And this lady had, there apparently was an escalation in the severity of her son's condition. and she had not been able to see him or hear from him. And very quickly, I was able to cut through the red tape and the bureaucracy and get a visitation lined up so that lady could see her son. And that's probably been one of the best things that I feel like I've been able to accomplish since I've been there.
Well, I know that all those successful moments are more than just one, but thank you all for sharing those moments with us and sharing your expertise, being open to hearing what is on our minds. And I encourage all of my PA colleagues to take tonight's event, think about how you have been inspired, what information you have from your expertise in your field to share with our legislative colleagues. And as they said, reach out, meet with them in the district. It makes such a difference. I do want to close by saying thank you to Emily Adams, our NCAPA Executive Director, and Carrie Burke, our Government Relations Manager and Lobbyist, for all of their hard work in arranging tonight's event. It has truly been inspirational and educational, and very much gratitude to our panelists and to our attendees. So I hope everyone has a great evening. Stay well, stay safe, and thanks for all you do.
Thank you.
Thank you.